Welcome to the Dietary and Hormone Optimization YouTube channel. And today we have a new guest with us. It's Dr. Andrew Winge. Welcome, Andrew.
Thank you, Stephen. Thanks for having me. I really appreciate it.
So before we start, maybe explain to the viewers who you are, what you do, and so on.
Sure. Yeah, I'm a conventionally trained MD like yourself. I'm board certified in family medicine and emergency medicine. So I still work, not quite full-time, but pretty close in the emergency department. I also run a small men's health and longevity practice. Obviously, TRT is a part of that. So I've been running that for the last several years. I did almost a full career in the Air Force prior to embarking on that part of my practice. I was in the Air Force for 17 years, and now I've settled down in Central Oregon.
All right, thanks. So today we're going to talk about maybe one of our favorite subjects, maximizing skeletal muscle mass.
Absolutely. Yeah, near and dear to both of us.
Yeah, I heard you state that before the age of 50, we should maximize all the muscle mass we can because that will help us in a lot of other stuff later on in life. So I have one more year. I have one more year at 49. So
yeah, so we're the same age. I turned 50 in 2 weeks. So
I have one more year. It's okay. I just turned 49 a few weeks back. So
all right.
So let's talk about that.
Yeah, I think a lot of guys intuitively understand that, especially when they start TRT, that they need to be doing resistance training. They need to be working their muscles. They need to be changing their body composition. But I thought maybe we could talk about this from a slightly different angle and from a way that maybe, the average non-medical person perhaps hasn't thought about. In my private practice, my patients are, they know this, but I hammer home how critically important it is, especially like you mentioned, before the age of 50, to put on as much healthy, lean muscle tissue as you possibly can. And then, of course, you have to fight tooth and nail to keep that after the age of 50. And of course, it's not that you can't build muscle mass, after age 50, but it obviously becomes a lot harder. The younger you start on this endeavor, the better. Obviously, if you start in your late teens and early 20s, that's ideal. But a lot of guys don't get into the gym, sometimes into their 40s. And of course, it's not too late, at that point. But I want to use an example actually from, I did a stretch of ER shifts last week that really, I think, will drive home the points of just how important this muscle tissue issue is as you get older. So I did a stretch of like 3 shifts last week, very, very busy. I work in a medium-sized community emergency department. So and we have 5 different nursing homes within the area. So I see a lot of sick elderly people. We have a lot of substance abuse issues there and things like that as well. So I'm extremely busy. I kind of jokingly say, but it's not really a joke, that I have a front row seat to the collapse of the U.S. healthcare system, because things are so much worse, I think, than the average person really understands when you're actually working in that environment. But anyway, when I showed up on shift, I took over care from the doc who was going home, and there were 5 patients in there who all of them were over the age of 70, and all of them were in the emergency room, and they'd already been there for at least 24 hours, and they were waiting to be placed into a skilled nursing facility or a long-term nursing home facility because they were so weak that they couldn't take care of themselves at home. And the sad thing about that is they all had like relatively minor medical issues. There was a lady that had like a pubic rami fracture, which is a pelvic fracture, which a lot of times can be managed at home. There was a lady that had a very minor case of COVID with virtually no respiratory symptoms at all, but she just had fever and muscle weakness. Another elderly lady had a urinary tract infection that made her weak. But unfortunately, these people were so profoundly weak and debilitated and deconditioned before they had this insult that now just these minor, relatively minor little perturbations in their life, made it to the point where they could no longer even get up out of bed, couldn't go to the bathroom, couldn't take care of themselves. And, unfortunately, didn't have families that were willing to take care of them. So the sad thing is when I left 3 days later, all 5 of those people were still there, just waiting. And for all I know, they're still there, but that's the situation we're in now is, we have this, and I know it's the same in Europe, but in the United States, we have this aging population, and they're placing a tremendous burden on the medical system, which at least over here, and I'm sure over there, things are not so good either, is really, it's either collapsing or right on the verge of collapse. So I tell my patients, listen, I want you to put on as much muscle tissue as you can, not just because I want you to have a six pack and I want you to look good naked, but I want you to do that. I want you to think of it as a savings account that you can cash in on when you're older if something were to happen to you. So and what I mean is, for example, like I take care of people, for example, they come in with pneumonia, they get really sick, maybe they get put on a ventilator. Well, they lay in bed in the ICU for a week, maybe a little bit longer, and they become profoundly weak. 30 to 40% of their muscle strength is gone in under 2 weeks. And then now, we clear up their pneumonia, we get them better from their whatever infectious process, brought them in the emergency department. But now they can't go home. Even though we've corrected their underlying medical issue, they're so weak that they can't go home. But, imagine if that same 70-year-old, for example, came in and they had, through their efforts over the years prior, had put on, let's say, 25 pounds of, excess spare muscle tissue that they had in reserve that they could afford to lose. They could afford to lose that and still be able to get up out of bed on their own, still be able to go home. So I don't think a lot of people think about that. And I don't blame them for that. It's not something that the average person really considers, but the acquisition and maintenance of muscle tissue is perhaps, arguably, I've kind of come to this conclusion over the last few years, is probably one of the single most important things you can do as a human being to guarantee your own independence, your health after the age of 65. And again, we all want to look good. We all want to have the big muscles. I do too. But I also want to be able to go hike with my grandkids. I want to enjoy life at 90. And so I really encourage my patients and everybody that's watching this, in order to be a really successful 90-year-old, you can't afford to be average at age 50. Yeah. You have to be exceptional at age 50 if you still want to be able to do even some of the basic things on your own and still enjoy a good quality of life at your 90s. The sad thing is most people in this country, and I'm sure it's the same everywhere, is, those last 10 years of your life oftentimes are pretty miserable. They're pretty miserable. They're if they get to live at home, they're in and out of the hospital. They have to come see me in the emergency department twice a year for heart failure exacerbations, or their third heart attack, or about a sepsis. The quality of life is not good. And so Peter Attia says this, and I really like it. He says, he's training for the last 10 years of his life. And that's the approach that I take too. And the cornerstone of that, in my opinion, in addition to cardiovascular disease, which, we'll talk about later, I'm very, very strong on that with my patients. The other huge cornerstone of that is healthy skeletal muscle tissue. It's absolutely critical.
So what practical advice do you give 40, 50-year-olds then if they haven't been in a gym in their lives?
Well, I would say to them, obviously it's not too late. We have very good data showing that even people in their 70s and 80s that start a weight training program can have massive benefits, to the point where they no longer need a walker. They can get around independently. They reduce their risk of falls. But obviously the later in life, it's always hard to start a new habit, and weight training is difficult. It can be a little bit daunting. Certain gyms can be kind of intimidating, but I would tell a man in his mid 40s that has yet to start that kind of a program or step into that kind of world is I just would say, listen, you just have to do this. Like, this is, if you're not going to do it for yourself, do it for your family, do it for your kids. Because I don't want to, no offense, but I don't want to see you in the emergency department. I'm busy enough. I don't need any more clients in the emergency department. But I would emphasize, I encourage my patients to come up with a tangible long-term plan for how they want to age. And nobody does that. When I ask people about, hey, what are your plans for retirement? what they always tell me is they talk about their 401k plan and their, their real estate investments and, how I'm going to do things financially. And I've never heard anybody say that, well, I want to be able to hike 5 miles with 40 pounds on my back when I'm 70, which in my opinion is much more important than your 401k. And because that pays dividends in so many other ways. So obviously, you need to take care of your finances, but your health and your longevity and your ability to navigate life is just as important, if not more important. So I try to paint. I want them to really visualize what life is going to be like for them at 70, at 75, at 80. And it's human nature. I mean, we don't like to think that far ahead in the future. Some of us are just more naturally inclined, than others. I can remember thinking about this stuff as a medical student, back in the late 90s. And of course, at that stage, you don't really know anything, but I did know that I don't want to end up like these people that I'm taking care of. And I didn't know how to do that. I think there's a feeling that's somewhat inevitable, but if there's one thing I would want people to take home is that what we're seeing now, especially with these frail elderly people, I mean, it's not inevitable. It's entirely preventable. It's just you have to get started and you have to have a plan. We didn't launch a rocket to land on the moon without a plan. That plan was started in the late 40s. So if you have a plan to be exceptional, if you want to be exceptional at 90, your plan needs to start 50 years prior to that, at least. So.
Sure thing. But you can't be just telling people in their 40s, 50s, just go to the gym and do whatever. You have to give them some practical advice, probably, because a lot of them will just be on the treadmill for half an hour.
Right. Which, again, is better than nothing, but it's not what they need to be doing. Yeah. For optimal longevity. Again, I emphasize strength and hypertrophy training above cardiovascular training. Although obviously cardiovascular training is, I don't want to downplay that at all, but the acquisition of muscle strength and muscle hypertrophy is so critically important, and it spills over into so many other areas of health. I mean, we've got like 2/3 plus of this country is diabetic or pre-diabetic. So there's no better way to treat prediabetes than to build skeletal muscle tissue. They have yet to invent a drug that's better than resistance training for treating insulin resistance, diabetes, high blood pressure, etc. It's so important. And what does a gym membership cost? Not very much. Exactly. Not very much. Coming to see me in the emergency department with a heart attack is very expensive. Mm-hmm. Very expensive.
So. Since we have more or less the same job, seeing patients every day, and we have the same build, probably you hear the same excuse as I do. I hear a lot of older patients say, well, doc, you look great, but I don't have time to do that. Or I have a bad knee or a bad shoulder. I can't do any sport anymore. What do you tell those people?
Well, I show them the scars on my fully reconstructed shoulder. I show them the scars of my fused lumbar spine for my time in the military and my reconstructed right knee. And, somehow I still find a way to get to the gym 3 days a week. And I'm a jiu-jitsu black belt. I train jiu-jitsu 3 days a week. So, and quite frankly, when I did my residency training and I was working 100 hours a week consistently for 3 years at a time, somehow I still found a way to get to the gym at least twice a week. So I'm not having it. I don't listen to that. That's not an excuse. Dealing with chronic pain is part of getting older, especially musculoskeletal pain. But the best way to manage arthritis pain is to hypertrophy and to strengthen the surrounding musculature of the joint in question. So that's why they send people to physical therapists for knee and hip pain, because strengthening up the quadriceps, the hamstrings, the hip flexors, psoas muscles, all of those things will help with chronic pain. So I say, listen, if you have joint pain, the best thing you can do is to move that joint in a safe manner. Now, my older patients, and I do this myself now. I was a competitive powerlifter for a long time, and I didn't have a coach. So I probably accumulated a lot of wear and tear and injuries that I probably shouldn't have, just because I didn't know what I was doing. But as you get older, and I'm sure you can appreciate this too, is the style of training that you do has to really focus on injury prevention, because obviously you want to make progress in the gym, but the older you get, you can't afford setbacks. I've had 2 pec tears. I can't afford to have another rotator cuff tear and be out for 6 months, because as when you're younger, you can bounce back from. I use the example of when you have a broken arm and you're in a cast when you're a child. Your arm comes out, it's all spindly and weak, but within 8 weeks, I mean, it's right back to where it was. Well, the data is very clear on elderly people, especially after a hospitalization. If you lose 20% of your muscle mass after a critical illness, you're not getting it back.
Yeah,
you're not getting, or a tiny fraction if you're lucky. So, the same thing applies in the gym so I do exclusively at this point, machine-based workouts, because, and it's only for the safety reason. I love free weights, I love free bar squats and stuff like that. But, for me, the risk and reward it's not there anymore. So I do other things that are much safer. So, you can do resistance training all the way into your elderly years. You just have to, there's a safety factor, that you just need to maybe account for, that when you're 19 years old and working out with your buddies, everybody's trying to do a little bit more than everybody else. We've all been there. You didn't think about that as much. So,
do you still give the same advice to people you see in the emergency that are already 70 or 80 years old? Do you still stimulate them?
I do. If I have the time, it's hard to imagine if you don't work in that environment for the average layperson, but it is so busy and it is so chaotic. And sometimes these people are so critically ill and sick that you can't even have a conversation with them, because I've got them on a ventilator, or, they're out of their mind, from whatever substance they're taking. So if I have an opportunity, it's usually on night shifts. If I can get the place cleared out at like 2 or 3 in the morning, then I have some time to go around and do some rounds. And, I'll talk to this, the little old lady with her diabetes who can't get her sugars under control. And I'll do that. But, I hate to say it, Stephen, more often than not, they just look at me like I'm an alien. And they just, like I had one person years ago look at me and they said, well, you're just lucky. I can't do that. You're just lucky to, based off how I look, and I thought this has nothing to do with luck. There's nothing to do with luck. This is decades of trying to do the right thing and making good decisions every single day. And then when you do that, of course you get a result. So it's, I do my best in the emergency department, but, I hate to say it. Sometimes the horse has left the barn, so to speak. Mm-hmm. It's challenging. What I would have loved to do is get a hold of those people 10 to 20 years before they came and saw me in the emergency department, before they got to 350 pounds, before they got COPD, before they had their triple bypass, because all of that could have been prevented. And of course, like you have to want to do it. I mean, the kind of changes that we're talking about here, and the kind of things that you and I do every day, I think we kind of take it for granted, but there's a barrier to entry there for some people that's just too high. And you can talk till you're blue in the face to somebody, and you can show them all the reasons why they should be doing something, and they say, yeah. And they say, can I go out and smoke a cigarette? I'm like, okay, all right. It's tough. It's tough. Yeah. Not everybody's ready to hear that. And, unfortunately there's, there are consequences to that, they can't fully appreciate until they have now experienced them. And in some cases it's too late at that point. So it's tough. I do my best. The nice thing in my private practice is I get guys who are already, the whole reason that they sought me out is they're already highly motivated, and they just need a little bit of help to fine tune things. So I tell my guys, my goal for you is to get you in the top 5% of all men in the world for, for your given age and in a variety of different parameters. And many of those guys have already been working out for years. They've already, many of them are already on TRT. They may have some issues with their protocols. And so I do a lot of fine tuning. It's a bit uncommon for me to get somebody who's completely raw and starting from scratch. Although I do have guys like that on my panel, and I take that as a challenge. But usually those are guys usually that have had some kind of a health scare. And now something, now they're 45 or 50 and they're scared and they realize, okay, I need to do something, but I don't know how to go about doing it. Because that's the problem with the internet, of course. It's not a lack of information, it's information overload. And you'll see people on YouTube that will, even physicians that say diametrically opposite things, and so people don't know who to believe. So, on my little channel, I mean, I'm not saying that I have the final word in anything, but I at least, I try to do things in an evidence-based manner. I like to show the papers. So this is not just me making something up. This is what the literature shows. And, then you can decide for yourself if you want to go ahead and do it or not. I try not to be too pushy on things.
Yeah, that's the best way.
Except weight training. I'm very pushy on weight training. You have to lift weights. If you're going to work with me, I insist that you lift weights. Everything else is negotiable.
What dietary advice do you give together with the advice for weight training?
That's a good question. So again, I try not to be too dogmatic about it because I do think that there are many paths to health. But one of the crucial things that I think is beyond debate is you have to increase the amount of high quality protein that you take in every single day. And it's way above what the national government guidelines say. It's way above what your family doctor is going to tell you, if your family doctor even knows. So what I recommend for weight training athletes, just based off the current evidence, is basically the benefits seem to top out at around 2.2 grams per kilo of lean body mass. And you'll hear different, people will dance around that number a little bit, but it's convenient. It turns out that the gym bros are probably right. Like a gram per pound of body weight is probably optimal. But here's the thing that people need to understand is that as you get older, particularly over the age of 65, that number goes up. And there's this phenomenon called anabolic resistance, which, it's a complicated thing, but in a nutshell, for a given amount of protein, a younger person will have much more muscle protein synthesis. Say for 5 grams of leucine will create, X amount of protein synthesis. Well, an older person over 65 or so, to get the same amount of muscle protein synthesis, they might need 7, 8, or maybe 10 grams of leucine to get the same effect. So, but of course, what happens with older people is in this country and everywhere else around the world, they don't eat more protein as they get older, they eat less. They become nutritionally compromised, especially older people that live alone. Their kids have left the house, maybe their spouse has died, or they're divorced. But so the nutrition really, and that's a huge part of this age-related muscle loss that I see all the time, is the nutritional component. The nutrition is terrible. It's processed food, and it's generally like high glycemic, high saturated fat, low nutrient, and low protein. So if the one diet, the one must do, in my opinion, is maintaining high amounts of quality protein, divided throughout the day. And if you want to do that as a keto person, if you want to do that as a vegan, which I don't recommend, but there are ways to do that. But that has to be the cornerstone. If your goal is to not only build but to maintain muscle tissue into your 90s, you better really pay attention to your protein intake. I think the evidence for that is overwhelming. The fats and the carbs, I mean, we can debate about that. Yeah. And people do, and they love to argue about it. I don't like to argue about it. I let patients sort of manage that part of it in a way that, because it has to be sustainable, obviously. But the protein is not terribly difficult. When I go to work, I make a giant protein shake. And that counts as 3 of my meals, because I don't get a break. I don't get a lunch break. So, you just have to plan ahead. And if you're busy, you just, you meal prep. Yeah. And once you do that for a while, I mean, I'm sure, it becomes old hat. It becomes a habit. It's just starting new habits is tough. It's tough.
Yeah.
So.
Since you're lean toward optimizing hormones, do you also check the hormones when patients are through the most urgent things in the emergency room? Because sometimes I do with my dermatological patients when I hear from their history that they might have some low T symptoms. With all the rest, I just mark testosterone levels and so on. And sometimes I try to optimize them as well.
Yeah. So I don't do it in the I don't generally do it in the emergency department unless I think it's clinically relevant. Because, well, half the tests are not going to come back while I'm on shift. You know, they may take a day or two to come back. Obviously, I mean, there's a list of endocrine emergencies that I'm on the lookout for, you know, acute adrenal insufficiency and thyroid, you know, mixed edema coma. And so I then, you know, thyroid studies and things like that. But as far as testosterone, I don't send those tests. It's just not appropriate or relevant in the emergency department. However, I do occasionally, if I have time, have that conversation with some of the, you know, the middle-aged overweight men that, you know, come in with high triglycerides and borderline blood sugars, and, you know, many of the signs and symptoms of suboptimal testosterone. You know, once I finish up with whatever problem they came up with, I will say, hey, you know, before you go, maybe you should go talk to your doctor and just get your levels checked. You know, and unfortunately, I know that, you know, if they go see their primary physician and their total comes back at 280, they're likely to be like, oh, you're fine. I mean, we all know that story, right? But at least they're getting it checked. And, you know, it's entering, I'm planting the seed in their consciousness that this could be something to think about.
Exactly.
Because it is important. I mean, clearly it's crucial.
Without patients knowing it, I sometimes try to optimize them because I'm checking vitamin D, and that's always low. So you can always say, you need more vitamin D.
It is always low.
It is one hormone you're optimizing. So probably you see the same thing in the blood panels.
I see single-digit vitamin D levels all the time. All the time. And it's usually not me checking it. It's to the credit of in the local community. We have some good family medicine and internal medicine docs who, you know, they may not understand testosterone very well, but they appreciate vitamin D. And so I'm seeing less low vitamin D levels in the community now because most people are already coming in with vitamin D supplements. It's funny. We have over 300 days of sunshine a year where I live, and everybody's still obviously vitamin D deficient because unless you're working outside for hours a day with no shirt on, you're still going to be low.
Same here.
You know, that's a whole nother talk, obviously, but vitamin D is crucial for so many different things, including testosterone.
Any other supplements you recommend to guys 40s, 50s to stay strong for later in life?
I think, and I'm not a huge, you can get a little bit crazy with supplements and you can end up spending a lot of money, but there's some low-hanging fruit, not just in middle-aged guys, but this applies to elderly, both men and women too. I think creatine is a no-brainer. I have been on creatine every day of my life since I was about 19 years old. And, you know, despite what a couple of doctors have told me, I have not gone into kidney failure yet. You know, so, and it's one of the most studied supplements, but, you know, clearly we all know about its muscle performance enhancing abilities. There's now emerging data that it can help with cognition and patients that have dementia, even in congestive heart failure, people who are dealing with that, which is a huge segment of my population. So creatine I think is a no-brainer, 5 grams a day, capsule or powder format, whatever works for you. The other thing, you know, that I think is worthwhile considering, and I have a lot of my older patients on it, is HMB, beta hydroxymethylbutyrate, which, you know, for the listeners that aren't aware of it, most of them probably are, but it's a metabolite of leucine, and there's some reasonably good, you know, data on that in older people in terms of its anti-catabolic effects. So as a tool in people who are especially elderly to combat muscle loss, I see no reason not to take 5 grams of HMB a day. It's totally inexpensive. It does have good data. I think it's something that should be high on the list for most people. And then the other thing is high quality fish oil. DHA and EPA, and the data is so mixed on the cardiovascular outcomes with that, but there is actually some reasonably decent data, not only with in dealing with inflammatory joint pain, but also with helping preserve muscle tissue, especially like in elderly females, is one study that I'm thinking of. And it has other health benefits too. I mean, obviously eating healthy amounts of oily fish is probably best, but supplementing with fish oil, I think, is something that most people should be doing. I recommended my multivitamin just as an insurance policy. Obviously, there's not, I can't pull out a paper that says everybody needs to do that, but just off the bat, those are three. Magnesium is another one. Most people in the U.S. are magnesium deficient. That's a no-brainer to me. I have a list of kind of core supplements that I recommend for my guys. And those are those are the ones like at the top of the list. I've got a few other smaller ones that are less relevant, but creatine, HMB, fish oil, it's kind of hard to go wrong, and magnesium, kind of hard to go wrong with that.
All right, Andrew.
They're not expensive. That's the other thing. I try to be cost conscious about this stuff because you can spend a lot of money on supplements.
Yeah. Don't overdo it. Sure.
Yeah.
All right, Andrew, I think we had a great talk, a great overview about all the things people should do before they are older. So thank you so much. If people want to reach you, how can they do that? I will link the list of your socials in the description of the video.
Sure. Yeah, that would be great. Yeah, so my practice is at manmedicine.com. You can reach out to me. It's my email is my name, Andrew Winge MD @manmedicine.com. I enjoy fielding email questions and enjoy interacting with people. So I have a small YouTube channel too. If you want to check that out, if you leave comments in there, I do my best to once a week, I go through and I try to answer all the comments and questions in there. So that's probably the best way to get a hold of me.
All right. So thank you so much for doing the interview, and talk to you next time.
All right.
Check out my TRT workout split or the ebook The Ultimate Guide to TRT Cream. Links to the merchandise shop in the description.